Okay, hello and welcome to our third and final Pride panel, this one discussing LGBTQ plus healthcare. My name is Charles Besur and I will be the moderator. I'm the Vice President of Media at the Chippewa Valley LGBTQ plus Community Center. I will let the panelists introduce themselves, starting to my direct right.
Hello, I am Matthias Klein. I go by Matt. I am an MLT, medical laboratory technician. Basically means I run a lot of tests on blood. I draw blood too. And I volunteer with the CV LGBTQ plus Community Center doing a bunch of things. Resource related and library related mostly.
My name is Marshall and I'm actually a patient navigator with Planned Parenthood of Wisconsin. I'm actually based out of our lacrosse office, so I actually work with a lot of our transgender and non-binary patients and helping them get set up with appointments to start hormone therapy, to sending resources for gender-affirming surgeries or name changes, things like that.
So I guess first off, I'm a little curious, like, with the work that you do, obviously, Marshall, this is perhaps a lot directly with what you do, but what you do in healthcare, like, how does queerness then come into it? How does it affect it? Is it something that is front and center or more peripheral to what you do as a healthcare provider?
Yeah, as far as like queerness and everything, I mean, it's with Planned Parenthood, they're really trying to be very open with everybody, where it's coming to the point where we're even changing like verbiage on things so that it's more inclusive to everybody. So, we're always trying to learn and grow as we can. So, yeah.
I would say for me it is kind of more peripheral. I work at a hospital. There's a lot of just regular hospital stuff going on. I do test blood from queer patients, and I'm queer myself, so I work there. But it is definitely a bit more peripherally.
I know when this panel was proposed and discussed, a lot of stuff came up about how queerness historically has been medicalized, has been pathologized, has been treated either as a mental illness or as a physical illness or in need of medical treatment or intervention in order to discourage queerness. Do you feel that those are things that still linger on now, or how do you feel like that impact is still felt, even though most of the institutionalized ways that happened is no longer the case? It's no longer criminal here, mostly.
I go first?
Yeah.
Well, I would say that I work with a lot of people who want to think they're good on queer-related issues and are mostly trying, but it's very difficult to unlearn biases that we have been basically brought up with our entire lives. There are studies that have shown that in some ways you can't completely remove those. You can do what you can to be better consciously, but unconsciously we are still in some ways biased, even against ourselves sometimes. Obviously that's not saying that you shouldn't be doing anything about it, because in order to move past that you need to do things. I do see some treatment biases occasionally. I try not to myself, and I try to speak up about things when I can. Not sure if that's what you're looking for.
Definitely.
Okay.
Yeah, I kind of agree, with what you had said. I've worked in many different locations. Like my segue into healthcare started as becoming a phlebotomist, and so then I would work at a blood donation center, and we'd go out and do blood drives and everything. And I remember they had just started doing like plasmapheresis, and a patient had, or a donor had gotten connected and had made the comment about something, I can't remember if it was they had made a comment or if the person that was like setting them up were picking up on stereotypical cues, and had made the comment that after that donor left that we would have to destroy their donation because she knew that they were a homosexual. So, and that person, you know, clearly grew up with kind of like what you're saying, you know, so it's frustrating to know that it's still out there in some shape and form in some locations, you know, even just as something as basic as donating blood or plasma, that you have people that are like that.
Yeah, it's really unfortunate. I think sometimes people say things to test the waters and see if anybody is going to push back too.
Right. Yeah.
So that's why it's kind of important to push back when you hear things like that.
Exactly. Yeah.
And I feel that segues like nicely because blood donation is obviously a large visible part of like the lingering traces of the ways that queer healthcare is treated as fundamentally different, and often as like treating certain groups of queer people as inherently unclean or unable to participate in the same kind of health-related activities that other people can, like blood donation. It's something where you know, you see waves of it come at times. I think I've seen mention of like the recent monkeypox being linked to gay men as sort of like they're the ones who are spreading it, they're the vector, which echoes back through the ways that these things go often. Do you feel like this is something that, you know, we're making progress with, or is it something that you see people in your professions really starting to like treat it differently, or is it something that you think is sort of like just the same thing over and over again?
I feel like in my setting where I'm at, we try to be inclusive with everyone, and so I want to say yes, just because, I mean, like I said, we're open to everybody, you know, and so I want to say yes, but at the same time, and I mean, when I put myself into, like, whenever I go and see, like, my provider or everything like that, everything is very smooth. So, you know, it's hard for me to say yes or no on the situations because we're so inclusive with everything that's
Right.
what I'm used to, you know what I mean? So it's hard to guess anything else because we're so open at our clinics.
I would say recently there is a push to try and make things more inclusive. Red Cross did recently update so that they classified MSM can now donate after 3 months of abstinence, which is better but not great. Supposedly they're doing studies right now to see whether they even need to do that. The ASCLS is a lab organization. I know that some people in there are pushing to get that dropped entirely, no deferral period, nothing like that, because we test all the units of blood. There's not really great risk at this point for anything. So there are people out there trying to change the way the system has worked.
So then when you say that when we see where in the past there would be a public scare that then would become institutionalized discrimination, do you think that lever might be more resistant? You know, is that something where it's more difficult to do? Where it's, you know, you can still see the same public scare going on, but the institutions have guarded themselves more effectively against making that policy. Whereas in the past it was a fairly quick, there's a scare and then there's policy being made that was discriminatory.
I suppose. I just feel like there's a lot more scares right now. Certain areas are trying to push scares on everything, so it's kind of weird science related that the science is moving the way science moves, and the scare field is trying to just put scares everywhere and pull that back, but there seems to be more of a divide.
Okay.
Yeah, I can't really say anything other than kind of what you have said. Yeah, I really kind of feel the same way.
As healthcare providers, do you feel then that like you being queer, being part of queer communities perhaps, gives you a special insight onto providing care then for queer patients or for all patients?
I feel like it does, just because I think back, like I started my transition about 10 years ago, and I think about the process of like how nervous I was with everything, and how scared I was even just to make a basic phone call to set up an appointment to say, hey, I'm trans and I want to start my hormones. How do I go about doing that? And then I put myself into, because it was very easy for me to start my process, and I know that a lot of other folks don't have the resources and things that I had when I started my transition. So like I'm always putting myself into other people's shoes so that I know like how we can learn and change and make things easier for people, because it wasn't difficult in my process at all. And so I'm always kind of thinking about, you know, like what I can do better to make things easier for others that don't have it as easy as I did.
I agree with that, and I kind of like what you're getting at with, I think a lot of us end up trying to use the fact that we've gone through difficulties to be more cognizant of other people's own struggles, so to try and connect with people and make the entire process just better for everybody else regardless, even if they're not sharing our own particular identity, knowing that there might be a marginalized identity and how it feels. Try and just smooth that over as much as possible.
Do you feel as healthcare providers then that you're finding support with your institutions to do healthcare the way you want to do it, the way that you feel like it's most effective? I know oftentimes queer people are expected to be almost their own experts, you know, because there's a gap in knowledge typically between the queer people who have to know themselves and the landscape of their health in order to seek effective treatment, and doctors who are not often specialists in queer-related healthcare. Do you feel that you are supported at the institutional levels by, you know, your hospitals, by your healthcare groups, be they professional or organizational, like the ACLS or ACP or those sorts of bodies?
I don't know how much this comes up in what I do. I think generally speaking, they're trying to be better. I think progress is a little slow on that in big organizations.
Yeah, and I think that with Planned Parenthood, I mean, they're extremely open, like I've said. You know, we get Press Ganey scores back on different things, and we're always sending out surveys for folks to do after appointments and things like that. And we kind of have a motto of, and I think I said it earlier, where like we try and we learn. You know, so if we hear from a patient of, you know, I didn't like this situation or this went bad or something, you know, we're always trying to improve. And you know, I the role that I play, I can always go to, you know, the folks that are higher than me, that are my boss, you know, and say, hey, maybe we should go this route, or you know what I mean. And we've got folks that are out in the community, you know, trying to get surveys and things from folks. So I 100% feel that Planned Parenthood is totally back to me and everything. So yeah.
sympathetic. This sounds really promising.
Yeah.
That's like cool. Do you think that that's the direction that healthcare should go and is going to go? That's sort of like more cooperative, more feedback?
I hope so. I feel like it is. Recently, I actually had driven by Gunderson down in La Crosse, and they actually had a big banner that they had like right on the side of the hospital, and I can't remember exactly what it said, but it was like love for all or something like that, and it had the rainbow pride flag out there and everything. And so I really kind of feel like, you know, with the organizations and hospitals that are in our area, and I don't know much for Mayo Clinic, but like I know up in Rochester they do have you know, like gender affirming care that they do and programs like that. So I would assume that they are also probably in the same boat with Gunderson, where they're starting to really kind of like open up and realize that, you know, that we have this in our community, and not that it's like a bad thing or anything, but like, you know, we need to be open to everybody, because I mean, in the end we're all human and we need healthcare.
Groups of people that are underserved at the moment, and I guess trying to be better about getting to them.
I guess as disclosure, Mayo is like our big sponsor for Pride this year.
Is
So,
that right?
so.
Well, that's good to know that.
And Marshfield is also a sponsor of ours. So
Okay.
at the moment, we're being treated fairly well
Good.
by the institutions at least.
Good.
That doesn't mean you don't have to. You have to say only nice things. But, but is there? Do you see there as, I guess, further to go? Where would you like to see it go further? Is it simply just like stay the course, or is there like something even more that you'd like to see happen in places like that? Is there any like next steps that you feel like, well, it would be nice then if they're this far already, if they would just go that far? Is there anything like that?
Honestly, it would be nice if people were better educated and more visibility, so more out queer people and providers and other staff that just know what to do, know how to handle us, know how to treat us, aren't weirded out. Don't make us explain things to them when we're coming in and asking for something.
Mm-hmm.
Yeah, I agree. And we, you know, with kind of like some of the updates that we've done, you know, since we've taken on our gender affirming hormone therapy care, I mean, we're to the point where we're asking what pronouns you prefer to use, what your gender identity is, you know, giving the options of either you can select male, female, female to male, male to female, gender queer, whatever you're comfortable with. And that's something that I've always wanted healthcare places to do, to allow us to be able to decide and not have it just be, well, this is what your birth certificate says, this is what we have to go by, you know what I mean? So because that comes into play then of sometimes how we're treated. So I really do hope that there are steps like that that are made, and I'm sure there's other things that I could probably think of that I wish we could get to, and I hope that we can get there.
I would add, along with this, is that queer groups, like all of them, are completely understudied when it comes to any sort of healthcare. Everything from drugs to mental health, there's just not very many studies.
Right.
It would be great to have more information.
Right. Especially when lack of information is used against queer populations to deny them healthcare.
Yeah.
And I do want to like touch on the ways in which healthcare is still very much a political entity, and the unfortunate and tragic side effects to how some of the movements in the country have gone of late with allowing people access to healthcare, with treating certain identities as unhealthy, inherently unhealthy. Like if, like in Texas with the, trying to say that affirming care is child abuse, and in Florida where they're trying to deny people who are on Medicare, gender affirming care there as well. And while those are pockets, and one hopes that that's something that can be resisted locally at the institutional level, it is definitely something that impacts how people in those areas are interacting with healthcare. Do you feel that that is something that, or how, I don't want to be like, how much sleep are you losing? But like is this something that you very much feel is like a threat to the way that you do your job, the way that you exist?
There are times where if I sit and think about it, I do get stressed, and worry that something could overturn and the services that we're providing are gone. Even with like everything that's going on with Roe versus Wade and everything, that's terrifying. Because really all that you're doing is taking away safe abortions that are still going to happen. And that's terrifying to think about the implications that are coming along with it. Like, if we take somebody there to get an abortion, we're going to find this much, and everything else that comes along with it. So if I sit and I overthink it, I do get terrified with it, just because there's services that we need to have. Yeah.
I think it really does cause a lot of people to be afraid to seek help when they need help, and I think that is the point. I think they want us to go into hiding and, expire, die, not exist. And I think a lot of these things are to legislate it, but also to scare us into basically removing ourselves from society.
Do you, aside from, I guess, not voting for people who institute those things, do you see there as being ways that those types of things can be pushed back against at the local level, at the personal level? Like, do you feel as healthcare workers like there's anything you could do in the face of that? And do you feel like your organization would support anything like that? Or hypothetically, do you think that there would be anything that could be done if things start getting bad?
Well, like we were saying before, I think organizations are trying to do better, so it is kind of weird to have all of these laws where we work with people who don't want them. I think it's going to be dependent on individuals at that point about whether they're going to follow the law or do what is right.
Yeah, I think, like I said before, Planned Parenthood would definitely step up and do what they could to continue providing the services that we provide. If it came down to it, even now too, I know that there are folks in the, with our program with the company that, are doing everything that they can for some of the situations that are in the news right now. So I know we would definitely, fight any way that we could, doing what we're doing.
Yeah, and you can get involved doing things on a local level too, in local governments. Even just writing representatives. I was putting together a resource list because I'm a resource library guy. I do have on there, I think it's more specific to transgender issues, but someone has gone through and made a list of all the different laws in every state that they're trying to push through, and I think there's also a list of representatives, so you can see if something is trying to be pushed through right now, and you can write to them, tell them, don't do that, you know.
Yeah.
And it does make a difference if they're seeing a lot of people saying no to something, that might actually change their minds.
Well, to step back from like dire apocalyptic thoughts, when the center ran our first LGBTQ plus census, which you put together, so this is so fun. We got back a lot of like interesting information about health and healthcare specifically, and about sort of disparities within healthcare. And one of the biggest things that we saw was like differences in how queer groups are kind of treated in general. It's like not awful, like there was a lot of stuff that was like vaguely even throughout, but like certain things, like especially when it came to like transgender people in the area, like how far you had to travel for healthcare was one of like the hugest differences, because it shot like way up. Like suddenly you're seeing majority or large percents of people having to travel over 100 miles to get healthcare, whereas most other groups can get it locally. And obviously places like Planned Parenthood I know are opening hormone therapy in Eau Claire and stuff like that, and I think Matthias talked about opening a clinic there, but do you see ways that people who are maybe more geographically limited in their healthcare options, like, do you know of, or are there ways that you could sort of speak to like how they could go about getting healthcare, or at least information about where they could get it? And especially with the pandemic, do you see a rise in like remote care being more widely available to people?
I think even with remote care, they want to see you usually. So if you're doing long distance remote care, you're probably still going to have to go in and do that travel if that travel is still long. I don't think they prescribe hormones or that, at least a physical appointment maybe, or...
So for us, we actually only have really like 2 clinics that are working with like the trans community to do our hormone therapy. So it's up here in Eau Claire, and then we've got our lacrosse office where I'm out of. We cover the whole state. I would probably say, I don't even know what percentage is all by telemed. Yeah. So it does make it very easy for many people if they have the resources to connect. If they have a cell phone, if they have a laptop that has a camera on it, given that situation. So if they have those resources available, we try to make it as easy as possible to be able to connect by video chat so that we can go through everything. The only time that they really have to come in is for lab work, so that aspect then of transportation comes into play. But then we also try to get them set up at either like a Planned Parenthood that's close to them, or we can send them to an outside lab at a center that's close to them, as far as like a small little clinic that has a lab in it. We can say, yep, we can send your labs to that location if they're okay with taking these orders from us. So we try to make it as easy as possible for everybody, because we do have folks that are way up in the north woods of Wisconsin, and then we've got some that are right on the border of Illinois. So we've got people that are all over the place. We try to make it as easy as possible for people to get their lab works and their appointments done.
Good to see.
Yeah.
I mean, are you also seeing like less of an emphasis on like you need this many like therapy appointments, you need this much like mental health care in order to make these decisions?
So we are all based off of an informed consent model. So we don't require you to have a year of therapy. We go through a consent form. We go through what changes you'll see, what options you have as far as administrating your hormones, things like that. So I mean, usually your first appointment's about an hour long, and that's going through everything, your past medical history, past family medical history, making sure that there aren't any contraindications at all that might come up if you start your hormone therapy. So, yeah, we go pretty deep with it. Yeah.
And so there again, it's like, are there things then that I'm assuming that the work is being done, but are there things like as a queer healthcare person, are there things you're then very excited about coming up that might happen or that might be possible, that perhaps you did not have access to because of the way that healthcare has or was even a decade ago with regards to a lot of this stuff?
I'm not sure. I like that it's become, I guess, more well known to be queer in various ways. I was kind of, as a child, completely restricted from a bunch of that. So figuring myself out was very difficult, and I think people now generally have a much easier time, which is really nice. It would be nice if that continues, I guess. It's good to see.
Yeah, I agree. I think when I originally came out, before I did my transition, I don't ever remember like going online and reading things or anything like that. I think it was just kind of a feeling that I had. And then I was just like talking with other people that I could get to know or that may know other queer people that I could talk to. So I don't ever remember like we never had the phones that we have now. Back when I was 15 to 18 years ago. So now I think it's really evolved with being able to go online and get resources and read through everything and read through blogs and Reddit and whatever else and see what other people have done. And I think technology is just going to continue from there to make it easier for everybody. But yeah, I can't really think of anything like specifically of like what I'd like to see. I think I'd just like to continue seeing technology go the way that it is and making it easy for people to get resources and access things online.
I don't know, we have like an additional resource sheet that will be made available for when the video is posted online. But do you have like go-to places that you like as medical resources, as like or places to go to learn more about what's going on currently?
I kind of have a handful of them. And of course, there's a handful that I stay away from too. And we won't, I'm not going to name any names of anything, but, I think just being in my position and everything with Planned Parenthood, they actually keep us very well informed on things as well. And they do provide information, on their websites that we can go up to and read. So I tend to like to go out to other new places too, where I've heard, like people say, oh, I've checked this website out, or, I get some of my resources from this place. And, I'm always kind of down to just see like what others are seeing and reading, just so that I can kind of get an aspect of that too. And I not just be kind of like, oh, here's my 4 little sites that I go to that I read on, or you know what I mean. Like I think it's just easier to be able to build up my resources, and learn from others, and you know, where do you get your info from, and see if it's actually legit too. That's also the hard part of the internet too, is that I mean you can run into homemade websites that are just somebody's opinion. So you know.
Yeah, I would say this is kind of shameful, but social media is a really big thing for me, and you gotta work really hard at curating that though, because it's really easy to end up following, I guess, people who are actually kind of harmful. But if you can kind of curate that appropriately, you'll get so many different people from so many different places that are basically posting what's local to them or something new, or they're in endocrinology and you're not, and they post this thing that you never would have seen because they're involved in these other organizations over here, and you know, just varying it up, but being careful of how you do that so that you don't end up in turf land or whatever.
Right.
Yep. Okay. We're like almost at we're about at the time where I would ask for questions from the audience. Oh, okay.
It's more for Planned Parenthood, so sorry, Matt.
Sorry.
Has there been surveys or studies on like what the percentage of queer people that you treat are? Whether it be local with lacrosse, regional, state, whatever?
Sure.
Have there, I mean,
I'm sure there probably has been. I myself am not sure like what the numbers are, you know, or where we're at with that. Whenever we're setting up appointments with new patients or even existing patients too that we may not have seen for a while, you know, we sometimes dive into, and I'm just like imagining like our check-in process of, you know, like asking like what your gender identity is, and we can even go in depth of being like, well, you know, if you'd like to share what your like sexual orientation is too, you know, so I'm sure there probably is numbers that I just don't know of. So.
okay. I was just curious because I feel like it's probably higher than the traditional, even a small time clinic or something like that, so.
Yeah, I mean, just kind of looking at the aspect of like testing, you know, like STDs and HIV and all that kind of stuff. You know, I'm sure that the numbers are quite higher than just a normal, what a normal clinic would see.
Those are pricey tests and can be scary going places, and Planned Parenthood is, as an image, a lot safer than just your general clinic.
Yeah, it can be very nerve-wracking, you know, and I've been with patients, you know, that are very terrified to even step in the door, and we're completely judge-free because we know how life is, and there's no reason for us to sit and judge anyone, because all we want to do is just make sure that you're staying healthy, and you're getting the help that you need, or you know, the medication that you may need, or whatever. You know, so it can be terrifying, you know, to have to step foot into, you know, Planned Parenthood or something, you know, or any other location if you're worried about anything like that.
So do you feel then, this is something that sort of has kind of come up through that, but more specifically, do you feel like there's an adversarial relationship then, specifically almost, between like queer people seeking healthcare and the healthcare industry, specifically like insurance and things like that, where people are afraid that by seeking care for things, they lose a level of anonymity, like they have to be out in order to seek certain kinds of healthcare, and they have to disclose. And because of the way that healthcare has been treated, you know, that's almost like, you know, admitting a pre-existing condition, that suddenly you're going to be vulnerable in some way. Do you feel like this is something that we are, that that you personally sort of have to have this adversarial relationship with not with your specific employers, but with like the system of healthcare that we have in this country.
The system is totally awful.
Yeah. Yeah.
For everybody. But it does kind of go back to wanting to have the ability to just be out and not have that be a thing that you have to like come out for, that it is actually completely normal care to come in and seek a vaccine for something, hepatitis A or whatever.
Right.
Like, it's normal. That's just normal people healthcare. And it would be great to see that that was pushed more, but there's still a lot of prejudice in the system. Obviously, insurance is just,
Yeah.
I don't know anybody who doesn't have issues with it. So,
Yeah. Yeah, no, I totally agree that I hate having to deal with insurance. Even just as my, personally too, when we run into, folks that might be on like a family member's insurance, and they may not want them to know, that they're starting hormone therapy. So that part gets to be frustrating because it's like, why does it matter? Just, yeah, I just get infuriated with having to deal with insurance companies. Yeah.
And I guess through that then, is there, how do I do this one? So going back to sort of like the historical ways that queerness has interacted with healthcare, do you feel like health means something different in the queer context? Do you feel like that is something that's more complicated than people who are outside of those experiences might think? And if so, maybe like how? Where do you see the complication? Yeah, now I'm asking to do.
yeah, it's more complicated, I would think. I think a lot of us have been taught to hate ourselves and to think of ourselves as filthy and disgusting and, freaks or whatever. And anything associated with healthcare also becomes associated with that. So you're almost sometimes ashamed to go in.
If you do.
Yeah,
Yeah.
just on a low level being, I guess, taught that your body is filth.
Right.
Yeah, it affects everything.
Well, do you feel then it's like, I guess what I'm trying to get at is there a way in which you feel that like health in general is something that for the larger public they would just cut that off from queerness? Like you have to choose one. You can be healthy or you can be queer. Because even when we're talking about like informed consent and things like that, there's a sense of like, well, what do you have to be informed about? What are you consenting to? What is an increased risk of X, Y, or Z when it comes to queer issues? Because, you have an increased risk of contracting HIV if you do certain things, hypothetically, So the implication is to be healthy, you have to not make those choices. And that sort of dominoes through a lot of queer identities for people who are told that in order to be queer or in order to act on their queerness, they have to give up being healthy. Do you feel like that happens? Do you see that in patients? Like people who might refuse care because why bother? Or, people who would make other unhealthy decisions, who would sort of internalize this in a way that would say that if I can't be healthy, I'm just going to go all out? Or
I guess I could possibly see that with some. as far as, thinking like, of the judgment that they might receive when they go in or something like that, where they might just be like, I forget it all, I'm not gonna go in, I'm just gonna continue living my life the way I am and doing what I'm doing. I don't
I almost feel like the moment anybody knows you're queer, you suddenly become diseased just for existing. So it almost is like, not that then you are choosing, but literally by choosing to be queer, you died in some way, made yourself, I don't know. One of the things that I think is interesting that I've noticed at my job is that everybody is still really afraid of HIV, like a lot. So there's the big three bloodbornes, the hepatitis B, hepatitis C, and HIV. And right now hepatitis C is what you should really be kind of worried about because we can't vaccinate for it and treatment is not like the best. I mean, we do what we can, but we have drugs for HIV. It's not like terrible, yet anytime you hear anybody accidentally gets a stick or anything, that's the thing everybody's worried about. That's the first thing everybody talks about. That's what everybody's scared about, even though it's not a big, scary thing as it used to be. It's not the death sentence it was.
Right.
And I don't know how much of that is a holdover from the time. I know back then we were doing things in lab like bleaching needles and reusing them to do draws, and that passed on disease, and people were scared, people were quitting. It just, I don't know how much that's a holdover from that and how much that's a thing that's just in our society. It's probably both.
Do you have any amusing anecdotes that you can? Because I'm always up for and not HIPAA and all of that, but like, is there anything that, as a healthcare worker and as a queer healthcare worker, that just makes you happy sometimes, or that you've done, or that things go on like that? Oh no, it's the pandemic. You're all just very tired. It's like, I don't think I've met a healthcare worker who's been through the last couple of years who isn't just like tired.
Yeah.
Or, no longer a healthcare worker. So that's like, I guess that's, with the pandemic, do you feel like this is something that, like, it's just been so large. Do you feel like there's things that are coming out of it that are good things, I guess? Do you feel like this is just something that's all bad that you want to get over so we can get back to like other things? Or like, where are you at with that?
I feel like, with Planned Parenthood, when the pandemic first hit, I was only like 3 months in with Planned Parenthood, and I was like, of course, this was what would happen. Is I finally am out of the bird's nest and I'm flying on my own, and then boom, COVID hits, and it's like, no, we gotta change this. We're changing how we're doing this. But I feel like that has also helped open up ways that we're able to provide access to healthcare. We are even trying to set up locations where somebody could go, like if they don't have access to a computer or a cell phone or like a smartphone or anything like that, where they could come in and say, I think I have a UTI, or something's going on, or whatever, and then they could be seen, or they could kind of go through what their symptoms are, and it's totally remote. And so I really feel like it's kind of sad that it took us a pandemic to be able to get to telemed visits and stuff like that and make healthcare easy for everybody, because now I look back and I'm just kind of like, I don't remember what it was like before COVID hit. it's just like, yeah, nope, it's totally easy to connect with us, stop in, whatever. So it's kind of, in my eyes, and this is just with Planned Parenthood, I don't know what it's like at a big hospital or anything like that, but I kind of feel like the pandemic did help in ways like that of being able to reach out to as many people as we can and tell them that it so
I'm actually really curious about that. For people who don't have cell phones or computer access, how do you get the word out? Like, how do they know where to go?
right.
Yeah.
Our folks that work in the community do a lot as far as like, stopping in at locations, leaving pamphlets, leaving business cards, flyers. It's even now getting to the point where like we could do ads on Facebook, or even if you know how phones are to where you can sit and like talk about, well, I guess that's what cell phones, but you could be talking about like a stroller or something, and all of a sudden, boom, there it is on your phone. So but like we can even do ads on like Spotify or something like that, where we can even start to reach out, or things like that. But again, if they don't have a smartphone, it's more so paper that we try to get out.
So like out on the ground, on the library, and
Things
supervision
like
on the net.
Yep. And then of course we always hope to do word of mouth too, from others that have gone to Planned Parenthood, that can spread the word to family and friends that might need help or might need our service.
Thanks. I don't remember what the question was.
That's about COVID. It was like, do you feel like has there been any good outcomes in how you're doing healthcare from this, or is it just all no?
Well, I got into this as COVID was happening, so it is also all I know.
Oh, it's a
and from what I learned, though, no, it's been just totally awful. But I don't really do outpatient work. I'm pretty much exclusively inpatient, so I don't see the end of people making appointments online instead of calling or at. I'm sure the setup is there for that. It would be good if they continue that. I think that has been great for a lot of people.
Right. So perhaps in some specialized medicine might be experiencing a little bit better out of it than like emergency medicine. Okay, that makes sense. Do you?
Totally not an amusing anecdote, and not necessarily queer related, but please don't put things up your butt that aren't supposed to go up there. Yes, kidding.
We have arrived as a panel. Congratulations.
Yes.
Okay, yes.
That's the amusing thing.
Okay, let's segue from that. I'll take that. Let's segue, because you're both healthcare providers. Like, what advice could you give to people about how to better advocate for their health, or how better to approach healthcare to actually get things out of it, rather than people who might be like hesitant or scared to seek help? Like, what advice would you give to people to like better take care of themselves and their health? Other than don't shove stuff up.
I'm just saying, sometimes there's traumas.
That
for this,
isn't
and
made
it's
for
not.
that.
Yeah. You don't want to go to the ER with that.
Okay. But otherwise, do you have advice that you could offer people that think that
I think people should go easier on themselves. I don't know that that's necessarily completely what you're looking for with that,
No,
but
let's just run with it.
it's hard to take care of yourself if you're being very critical of yourself.
Yeah, it's kind of easy to put yourself in the spot where you feel like you're almost kind of in like a spotlight of like, oh my goodness, I'm queer, and now, if I say that I am, that means that I have this or I have that, or whatever. And I think just making sure that you have to keep yourself healthy, I was gonna say so. But, yeah, of course, I'm always gonna be a huge advocate, not that I'm biased for Planned Parenthood, but, don't ever be scared to come in. You know, I know it can be terrifying and I know it can be nerve-wracking, but I'll guarantee that you'll be greeted with a smile, and whatever situation you might be in is not going to have any sort of terrible reaction from us, because we know how life is and we just want to make sure that you're healthy and good.
Unless there's other questions, I guess we can start to like, do you have any closing thoughts? Just sort of like health and queer health in particular. It's okay if it's a no. You don't have to have closing thoughts.
Makes me feel like I'm doing an essay or something.
I guess like my biggest thing is like just not to be afraid to like ask for resources or to try to get in contact with people that you know that are in the same situation or something like that, because like I'm thinking back of when I first started transitioning and I had a situation where I had to go in to emergency and I told them that these are my pronouns, please address me by this. They were addressing me by my legal name at the time, using she, her pronouns, and I just remember just being like infuriated and just being like, this is the only spot here that I can go to get help, and I just remember like thinking in the back of my head, like, if I can ever make a change for this and make it easier for queer, non-binary, trans people, I want to, try to help them. But I didn't let that scare me from going into other locations then, because like right away I was like, well, if this is how I'm going to constantly be treated, I don't want to go to the doctor, if they're not going to listen to me. And I was polite, like I was like, yep, if you could please address me as Marshall and he, him, that would be great. And I just never, you just got to look out for yourself, I guess is kind of what I'm trying to say, is that you just got to be your own advocate. Don't ever be afraid to go elsewhere too, if you can, if it's possible. I know in rural areas they have one clinic that you can go to, which makes that difficult. But
If you're queer, you're awesome.
yeah, pretty much.
There's nothing wrong with you. You deserve good health care. Hopefully there's local organizations you can check out that will point you in right directions too. There's always the internet, although be careful.
No, that is a great message to close on. Thank you both so much for coming and for sharing your experiences and expertise with everyone. And yeah, it's been wonderful. Thank you. Oh.
Really nice people.
Oh, you remember a nice selfie of me now. I was gonna say, do you want me to take one with like
the sign in the back.
I'm
It
talking
says you are
picture
made
that
of
looks
magic.
really good with the background. There.
Yeah, it was when the ACLU one, and the pictures I got that in the background of one of those, and I was like, that is really, like, it came out so well when I did
I know,
the
well, and like, moving the creativity one to here, it was like, what better way to
Right.
to center the creativity conversation
Okay.